Hey, good morning, everybody. This is Brittany with the Seniors Blue Book, and this morning we are joined by tons of my home care friends. We are going to be talking this morning, just kind of checking in with everybody and talking about kind of some of the specialty programs that they provide with private duty, homemaker companion, skilled care. So without further ado, I want to jump right over and start kind of picking on people here this morning. So I'm going to start with Francesca with Perfect Solutions for Seniors. How are you this morning?
I'm doing great, enjoying the beautiful weather. I put a sweater on,
Me
so.
too. Plaid boots. We're in Florida, so if it's, not 90 out, we're dressing for the winter time.
Exactly. But yes, my company is Perfect Solutions for Seniors. We are family owned and operated. My mom started this company 15 years ago. So like many of us on here, we do the two levels of services: caregivers, companions, and CNAs and home health aides to do that personal care, hands-on care. But really, my soapbox lately has been socialization, especially during the COVID era. How do we provide that to our senior population? Because socialization is not a want, it is a necessity for quality of life, especially for our geriatric population. Studies have shown with socialization, you have decreased depression, decreased anxiety, increased quality of life, and also for our senior population, it decreases cognitive decline. So that's what I really want to hone in. And what we do with our caregivers, even though the mandate for OCA is over, the every 2-week testing, if we have caregivers going into a facility, we're still testing them every 2 weeks for COVID. So our clients can get that socialization and that quality of life that we really, really hone in on and go after.
I know even just, any of our ages, that socialization is so important for all of us. I was just saying before we were on here to you guys, working from home, it does get to you. And it's like, so we're kind of experiencing like a very small piece of what it's like to be, older and in the older population, and what they're experiencing of just getting out to the grocery store, just getting out to get their medications, or, it's quite a feeling to experience even just a little bit of it.
Exactly. So if we can provide an aid that can be one-on-one with a client, playing games, reading a book together, taking walks together, that's what we really are honing in on. And I just want to dispel this myth that socialization is a want. It's not. It is a true necessity for our quality of life.
Awesome. Well, thank you so much. I'm so glad you guys are focusing on that. And I'm going to jump over to Irene with Interim Healthcare. Good morning. How are you?
Hi, good morning. I'm well. Thank you for having me. This is my first time participating in the Senior Blue Book forum. I am subbing for Dr. Anthony Cortez, who is the owner of the Sarasota office of Interim Healthcare. Interim is actually a nationwide company. It's got offices all over the United States. Our office here in Sarasota, I think, has only been operating for about 1.5 years, but during that period of time, we've had tremendous growth. We are a private duty, skilled and non-skilled home health agency, so we can provide both services in the Sarasota County. I've been with the organization for just a few months as director of nursing, so getting acclimated to their processes. But one of the things that that we also do that I'm not sure you all are aware of is that we provide support staffing services to those facilities. So skilled nursing, rehab, hospital, doctor's offices, medical clinics. We can provide supportive supplemental staff. Right now we're recruiting actually a nurse for a physician's office, a pain management clinic. So we do those services as well. And we also work in partnership with some of our other local home health agencies to support one another when they have needs for staff and can't support a new client that they have in an area maybe that it's a little rough for them. So we work together in unison to support, because I think that's helpful. And I think there's plenty of business to go around for everyone, and it's nice when you can have that support. We have been also very successful this past year with the coronavirus providing temperature screening. So we have a large account with Tropicana and just acquired new PepsiCo up in Tampa as well to provide the temperature screenings for all their employees, and that's a 24/7 operation. We also staff a nurse at Tropicana to assist their clinic nurses, and that's a full-time position, and we potentially might be recruiting a nurse practitioner. for the PepsiCo office in Tampa to help them with their workers' comp claims. So we're pretty versatile in that, in the sense that, you know, beyond the home health and private duty in the home, we can support the clinical needs of agencies and other, you know, other employers. So
that's awesome. So which area do you guys cover? You have Sarasota, but it sounds like you guys go further north as well.
Well, we because technically our area is the Sarasota County, and we do cover you know, Northport and Venice and areas like that. There is an office, an interim healthcare office that covers the Tampa territory. So we needed to work with them on whether or not they wanted to provide that temperature screening support to the PepsiCo company in Tampa, which they declined because they don't offer that service. So they, you know, allowed us to kind of step in and handle that territory. Normally we wouldn't go that far north, but we were very grateful to be able to have that opportunity and support their staff. So we'll be starting that actually tomorrow. October 1st is our start date where we'll be staffing them. So
that's amazing. I love that. Everybody's, you know, again, we've all done things and pivoted during these times, and so it's great to hear some of these new ideas.
Mm-hmm.
So thank you so much, Irene. I'm gonna pick on Doris with BrightStar.
Yes. Okay, well, good morning. Hi to everybody. It's nice to see you here. So for those of you who don't know about BrightStar Care, so basically we cover the areas from South Sarasota, Venice, down to Punta Gorda, Port Charlotte, Northport, and even Arcadia. Yes, and we do a combination of, you know, companion care. So that's kind of basic, you know, needs like, again, meal prep, light housekeeping, you know, taking a customer again to a doctor's visit, things of that nature. We also do personal care. So that includes bathing, dressing, toileting, grooming, things that include, again, hands-on care with the patient. And finally, we also have a team of nurses. So we also do skilled nursing. So we do have cases with infusion, IVs, putting together a med box again for a client. So it's basically a little bit of what we do. One of the things that makes us different is the fact that we are Joint Commission accredited, which is, again, for those of you who don't know what that is, it's kind of a major certification that is earned by the top hospitals and healthcare systems across the country. And I think we're just on one of the very few actually agencies being Joint Commission in the area. And also, I think we're very proud of the fact that we have won for the last 3 years in a row by Best of Home Care polls. So we have won Best of Home Care Leader, Best of Home Care Provider, as well as Best of Home Care Provider and Employer. Yes. So we're actually the only agency actually in the last 4 years having won for 4 years in a row. And we have different types of programs. We have, you know, transitional program that we're now kind of implementing again, helping people transition from the hospitals or from the different facilities going home. We have also done a lot of, again, screening, you know, temperature, you know, checks also with Amazon. We actually ended that like 2 weeks ago, but for the last like 5 months, we've been very active again with, again, different businesses in the community, helping them out to keep the employees safe. Again, keeping the, you know, again, the environment safe again for all the employees. And we are doing a lot of couples care, actually, you know, right now. So we do have several, you know, customers who are, again, couples. And so we go to their homes and kind of check and help, again, them with their different needs, whether it's dementia, with, again, kind of transfers. And obviously it's much better than, you know, having them independently, which would be much more, you know, expensive. So I think it's kind of a nice way, again, to ensure that, again, they're safe at home, they're fine, that they're doing well. So that's a little bit of what we're doing.
Awesome. Thank you so much for sharing. And
Okay.
Chaz, Miss hashtag stay home instead. I like that.
Yeah. Well, Home Instead is actually a worldwide company. So we operate in about 18 different countries. But just here locally, there's 3 local offices, Sarasota, which is the office I'm out of, and then we have Bradenton and Venice. So we partner with them quite a few often as far as sharing clients and caregivers and things like that. But one program that Home Instead does, and I'm going to mention this program because we're talking about the fall, so we're getting ready for Christmas and the holidays. But we actually focus on a program called Be a Santa to a Senior. And what that program does is we partner with local facilities. In the past, we've partnered with the Pines of Sarasota, McIntosh Manor, Springwood, which I believe now is called something else. But what we do is we go to different locations. We actually have a national partnership with Bell's Outlet, and we set up Christmas trees. And on those Christmas trees, there's tags of want lists or need lists for these long-term residents that live in these facilities. So we coordinate setting up the trees, we decorate the trees, we make the tags, we go and pick up the gifts, we coordinate putting the gifts together, and then we go and deliver them to their seniors. This year, because of COVID, it's looking a little different. You know, we won't have that one-on-one reaction. Normally, my boss dresses up like Santa, and he's got the full beard, and, you know, we go in and make a big deal of this because these residents don't get anything. They don't have family. They don't get to socialize unless it's within the facility. And their needs are a sweater. I mean, a pair of socks. It's kind of heartbreaking, actually. So we just tend to focus on making it the best that we can make. And we always request extra things. And we give them out even if they don't want them. So that's just one way that we give back to our community during the holiday season. Of course, we also focus on our regular programs. We have a welcome home program. We focus on Alzheimer's and dementia, you know, Parkinson's, we do CHF, COPD, diabetes, all that kind of stuff. But that's Bostis is one special program that I'd like to mention because we are getting into that holiday season. So that's kind of what we do. And we are a private duty, non-skilled agency. So yeah, that's our program of the day.
Awesome, I love that. I was thinking that maybe we could get Rich to dress up as Santa Claus on our Zoom December meetings.
Maybe.
I know I've put on some weight, but listen, we don't have to. I don't know if I can grow the top out, but I can get this white.
I was just
too.
saying, I think you can do this part.
A little salt and pepper now, but I think I can get that white. I'll start eating now. I'll be ready for December.
I think we're all in the same boat.
And we can all wear hats.
That's right.
And what's cool about this year is, you know, because of social distancing and COVID and everything, the Girl Scouts, golf, I work with them a couple times, and the girls have not, you know, they don't have much to do because they're not meeting with their tribes. They're not doing the regular activities that they would normally do. So I'm actually having the girls make handwritten Christmas cards for the seniors. So those are going to go in the gifts with that we give, just for a little added touch. And then
Fine, Chaz. I'll dress up as a Girl Scout. Fine.
There you go. We'll have you dress up as something.
Oh, I just got an image that I'm not sure is ever going to leave, but that's okay. Well, Rich, since we're kind of picking on you, let's go with you next. Let's talk about Comfort Keepers.
All right. Well, everywhere I go, I'm just a Chickalo. I am Rich Chickalo, Director of Business Development with Comfort Keepers. We are a private duty home care agency. We do provide non-skilled, and we do have a sister company called Quality Medical Services, which is the newest advertiser with Seniors Blue Book. Advertise, 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 right, Brittany? But Quality Medical Services offers everything skilled nursing as well. So we do kind of cover both skilled and non-skilled programs. One of the programs that I want to talk about that we pride ourselves on here at Comfort Keepers is our Just In Case program. And our Just In Case program is exactly what it sounds like. It is a no cost, no obligation program. We do a free home assessment. So we come out, and we always do free home assessments. We kind of put together a plan of care. We see what your need is, and we get you in our system. There's no cost, no obligation. You're not committed to any services or anything like that. And basically what it is you use us just in case you need us. So that way, if a need arises, maybe it's transportation, maybe you need light housekeeping, maybe you just came home from a procedure, you then can give us a call, and we can act, we can be there within the hour right then and there, because you guys are, because everybody's in our system. So it works out really nice. It's a way I like to kind of refer to it is it's an easy way of introducing yourself to home care without all the pressures of, oh my God, I have to do this many hours, I have to do this, I have to do that, I'm not ready for it. You just sign up, it's there if you need it, just in case.
I love that. I love that. And I think your phone's ringing, so that was good timing. They're calling now just in case.
They are. They're like, oh my God, Rich in the Girl Scout uniform. I need to see this.
In case we need a Girl Scout or Santa Claus, let's go ahead and sign up.
I said Girl Scout and now the phone stopped. Maybe they don't want to see me in a Girl Scout uniform. But I just want to give a shout out to Francesca. I thought that was fantastic what you were talking about with the socialization, and that's such a big part of, I think, what everybody on this call does is, socialization and engaging our seniors in activities, especially during the last 6 months.
Oh, yes. Thank you.
Well, let's go over to Christie Castro with HomeWell.
No, so I think we're the newest agency on the block here. I'm looking around. HomeWell got its start in the beginning of COVID. Been a great ride with COVID. I have been in private duty for over 15 years, and I knew I wanted to do something different, and I knew I wanted to do something unique. And we are just loving our methodology of how we approach private duty. To touch on Francesca, the first thing we lead with every patient that comes on board with HomeWell is life enrichment. As many of the people in the industry can tell you, we could teach just about anyone how to give a shower, how to turn a patient, how to change Depends. We can teach the technical acumen that is needed to provide private duty. What we can't teach is the personality factor that is needed to provide a quality life-enriched experience wherever they live, whether it's in assisted living, independent living, or in their home. So that's really what we interview for is this person positive? Are they happy? Are they going to enrich the life of this particular individual? We have a very developed life enrichment program. And this program's been in existence for a while because HomeWell is a franchise. And it's been in existence for a while, but what we found was it really moved to the forefront during the time of COVID when we saw isolation and depression skyrocket. And as that isolation and depression skyrocketed, we saw the degrading factors that occur when people are trapped in their homes and not able to exercise and get out. And once we start seeing that physical degradation of their health, then we start seeing lack of medication compliance, lack of nutrition and hydration, and it all just sort of spirals from there. And all of us in private duty, we watched this happen over the course of 6 months, and we're like, oh my God, what are we gonna do? And what we had to do was we all had to really pivot and focus on how do we provide this quality of life. And now that things are starting to open back up, it's getting better for our patients. But what we find and what we know is that it's really the person that you put in the home. If that person is positive, is happy, and they have a care plan that is well developed and well thought out, then you're going to have a lot of success. And that's what we really experienced during COVID is we had a tremendous amount of growth because people were really very happy with the services their loved ones were getting, especially children who were out of state, who were struggling. They couldn't get here to check on their parents. So we really focus and lead with life enrichment. I call it LEAP, Life Enrichment Activities Program. We have all the standard stuff, go home well, which is our transitional care program out of rehab or hospital. We want you to go home well. We do all the various programs, COPD, arthritis, dementia, Parkinson's. We have all the specific training programs for those disease processes. But again, it's, we can specifically teach and train to how to deal with the incontinence, but it's how to make a client how to have them have dignity while we're dealing with that incontinence. And that's a big part of what we do at HomeWell is helping people have dignity when they're going through these really difficult disease processes. That's all.
Awesome. Thank you so much. I want to flip gears for 1 second. So on the other side, look, are all of you, by show of hands, are you hiring for caregivers currently? Are you looking for some great personalities to join your teams?
Always and forever.
Always. It's always a question I ask, and I already know the answer, but it's still, you know, I want to bring it up on our calls because we do have, you know, such a vast audience that watches our videos. So if you are somebody who is looking for something so rewarding, all of these companies on this call are amazing. So I'll put each of your contact information, emails, everything on this post on Facebook so that everybody can see that. And does anybody have any last words of wisdom they want to share before we close out? Not everybody at once.
Get outside today. Enjoy the weather. Go outside.
That's what I was going to say too. Is, you know, obviously usually I'm in front of like a green screen inside in my little like cave, but get outside, get some fresh air. It's beautiful out today here in Florida. Thank goodness.
Yes.
Thank all of you for joining in today and spending your time here this morning, educating and serving our seniors and caregivers. I hope you all have a great rest of your day, and thanks everybody for tuning in.
Thank you.
Bye.
Thank you.
Bye.